Imagine a career or a calling that is so inspirational and fulfilling that 5 generations of the same family choose to make this their life's work. Well, you don't have to imagine it because today we're going to speak with the 5th generation of such a family, Dr. Saptarshi Banerjea. So himself, his father, grandfather, great-grandfather and great-great-grandfather are and were all homeopaths. So you'll often hear him start a sentence with, "My dad used to say," or "My granddad used to say." And you really get this feeling that homeopathy is absolutely ingrained in Saptarshi's DNA. I personally find it very inspirational that him and his family also use their wealth of knowledge to help the less fortunate by providing free care to those who need it through their charity, which we'll talk about in today's episode as well. So Saptarshi has a special love and deep, deep understanding of our homeopathic Materia Medica. So for the new homies listening, Saptarshi describes our Materia Medica as the language and our repertory as the dictionary. So in the Materia Medica, which is Latin for medical material, we write up all the information we have about a particular remedy which has been gathered during homeopathic provings, clinical use, and from a wide variety of other sources. So our repertory is the tool that we use, like a dictionary, to look up specific symptoms, which will then point us in the direction of the corresponding remedies, and then we can read up further about these remedies in our Materia Medica for a deeper understanding. So due to us having an estimated 8,000 homeopathic remedies these days, unlike the original 120 or so 200 years ago, it's very easy as homeopaths to fall into the trap of just repertorizing a case, then finding the remedy from there, and it can sometimes just feel really overwhelming to find the right remedy for a client. So due to Saptarshi's deep understanding of the Materia Medica, however, he is able to utilize this to do what him and his ancestors called rapid prescribing, where they're able to prescribe on the spot without the need to use repertories or a dictionary. I really like how he has such a common sense approach to the never-ending plethora of remedies that are constantly added to our Materia Medica and, really can feel very overwhelming sometimes as a homeopath. So Saptarshi suggests learning the 50 most commonly used homeopathic remedies, which we call polycrests, and really doing a deep dive into one of them per week so that within a year you'll have a deep grasp of each of these 50 main remedies or polycrests. He has many other pearls of wisdom in this episode, and I absolutely urge you to check out his YouTube channel and website as well. I'll have it all in the show notes, and you can just do a quick Google search for him as well. Saptarshi Banerjea, Banerjea, and you'll find him very easily online. Enjoy this episode, and if you'd like to support our podcast, please visit buymeacoffee.com/hangout to make a once-off $5 donation. If you enjoyed today's episode and want to continue the conversation, come join our Facebook group, Homeopathy Hangout Podcast. Thanks for listening.
Welcome to the Homeopathy Hangout, where we discuss all things homeopathy from around the world. And now my mum and your host, Eugenie Kruger.
Hello, homies, and a very warm welcome to Homeopathy Hangouts. Today, we get to speak to the incredible Dr. Saptarshi Banerjea. Welcome, Saptarshi.
Hello, welcome. Thank you for having me here. I'm glad to share with you my experiences. Thank you.
Wonderful. It's just such an incredible honor to have you on today. Now, normally, Saptarshi, I start this podcast by asking our guests how they were introduced to homeopathy, but you are a 5th generation, as in 5 generations of homeopath. So I have a feeling we can probably guess how you were introduced to homeopathy. So I think what I will ask you is, what was it like for you growing up in a household where homeopathy is literally part of your DNA? And did you always want to be a homeopath, or did you first want to study something else?
To be honest, my dad's clinic was in the same place as our home. So, we used to live in the 1st and 2nd floor, and my dad's clinic was in the ground floor. So when I used to return from school and seeing lots of crowds of patients seeing him and he's busy, so that that rubs off on you in some way. And from very early age, perhaps 12, 13, I dreamed of I'll be having this kind of crowd waiting for me. So it was a part of seeing that aura and growing up in that. So that was one of the factors. Also, from a young age learning, like it was like A for aconite and B for belladonna and C for chamomile. It was like that almost. So we grew up having homeopathic remedies, and so it was a part of our lives from a very young age. So, and that way I always wanted to be that.
That's incredible. And I think you've got a few brothers as well and a sister, right?
I have one sister. I have cousin brothers, just one sister, but she's not a homeopath.
Okay, so I'm guessing you guys had a lot of homeopathy in your household for every little ailment.
Yes.
I had to laugh because when I was interviewing Rukshin Master, she was saying, she would see people come and kiss her dad's feet. I'm guessing you probably saw things like that as well, hey?
I didn't have that opportunity, but I did manage to see the crowds, people coming in stretchers, and those things do have an impact on you.
Amazing. And I think she said she was like a teenager before she knew what paracetamol was, because you just don't get given it, right?
Yeah, exactly. We haven't, and I didn't have the mandatory vaccinations as well at that point of time because my dad didn't want to. And, we grew up to be absolutely fine.
That's incredible. Now that generation's gone on and you've got a beautiful daughter, and well, fingers crossed it'll be sixth generation one day.
She'll be the sixth one. Yeah.
No pressure, but So, and your family has got this college, Allen Homeopathic College, and just a couple of days ago on your Allen Homeopathic College Facebook page, they posted this little video of your 5 generations of homeopaths and the names of each one of them and a picture of each one of them and, what they did. And I thought that was wonderful. That was so cool. And something interesting I noticed is that the spelling of the surname just changed slightly, like with the EE at the end or EA. Why was that?
Yeah, it was initially EE, but my granddad insisted on having a little bit of difference. So he changed to EA, and we have followed that since. Banerjea's right now. I hope that will continue. Yeah.
Well, us homeopaths are a little bit different anyway, so it makes sense that he would want to change his surname slightly. So one of your ancestors, they created this quick prescribing technique, right? And I think we're going to be talking a little bit about that today, right? Can you tell us a little bit about? You said Calcutta prescribing. What is that, and how does that work?
If you go back in time, maybe say 100 years back, and Calcutta was considered as the Mecca of homeopathy, where every people from all over the country used to come and study in Calcutta. Vitulkas initially came to Calcutta, P. Sankaran, father of Rajan Sankaran, he also came to study in Calcutta. So it was like the convergence of people from all over the world to study homeopathy. And lots of busy homeopaths during that point of time, and, seeing about, 100, 150 patients in a day. So they had to develop this technique of rapid prescribing. It had to be classical prescribing, but it was rapid prescribing. So combining that rapid and classical prescribing, they devised a technique where you can see and, try and come up with a prescription, like, with my cough sounds, hear the cough and come up with a prescription. My granddad used to say, if a patient is coughing in your waiting room, you don't need to call him inside. You can prescribe on what he's coughing and you can prescribe the remedy. So that method of rapid classical prescribing has evolved from the busy practice in the 20th century Calcutta, and we have tried to bring that forward in different ways in our practice as well. So,
can you tell our listeners a little bit more about that? And maybe I should just interject there and say, if any of our listeners go on YouTube, type in Dr. Banerjea and type in cough sounds, you will have your mind blown by this incredible video that Saptarshi did in 2017, where instead of telling you about the cough, he actually coughs the different coughs and how they sound like. And I have this group of about 1,000 mums here in Perth, and we often listen to this video and watch it, and all of us are just blown away by how you are even able to do all those cough sounds. But you're so right. If somebody's in your clinic, they're coughing, you don't want to sit there for half an hour and ask them about the cough. Just listen to it. Yeah. But how did you develop this skill? And I mean, you've got 5 generations that you can, or 4 previous generations you can draw on. But for us other homeopaths or even home prescribers, what can we do to develop the skill?
It's again, sometimes all over the world, I'll say people do, and we do emphasize on the totality of symptoms while we are prescribing. But in many cases, we fail to see what is in front of us. For example, a patient with a skin complaint comes to us, and sometimes we ask questions from head to foot about his emotionals, about his generals, but we fail to notice what is in the skin, how the skin is looking, how the skin is appearing. And sometimes that is one of the important factors, because, we prescribe on what we see. That I have learned from, age 17, 18, when I started to sit in with my father, that, look at the outwardly reflected picture. What is the patient presenting to you? So, you have to keep it simple, and you look for a skin case, prescribe on what you see. For a child, how the child is looking and behaving. For, coughs, how the patient is coughing. So sometimes, it helps to keep your mind clear and simple. And that is what I have tried to, incorporate in the cough sounds, even, in my skin cases, where I find good successes in what the patient is presenting me with.
Anything else? Sorry, I'm going to drill you a little bit, because this is something that I think is, it's easy to over mentalize the case, but you're right. Actually, just look what's in front of you. But how further can we develop that skill? Have you got any other tips for us?
To be honest, I will say sometimes it's, if we start from a early, especially for early homeopathic prescribers, we start seeing patients early, and like often what we do is, we finish our curriculum and we finish studying, and then we start seeing patients. But when you incorporate seeing patients gradually from your studying years, I think that really helps in going a long way, so that you learn that what the patient is expressing, and you can correlate what with the patient is saying and the symptoms of your Materia Medica, symptoms of the remedy at that point of time. And I think that will help if we concentrate also on treating people at the same time while we are studying. I think that will help in a long way as well. So that helps. And perhaps, one of the factors which has helped me is I have sat in for a long time with my father, with him, and seeing patients and, learning the language of the Materia Medica. My dad used to say that, that there's a difference between the cup and the lip, that the symptoms which is there in the book, but sometimes we miss it when the patient is right in front of us. So see the people as well as see the book at the same time, and that will help you draw the analogy at that point of time as well.
Now, you are a master of the Materia Medica. Any other tips you have for homeopaths on, because these days with 8,000 remedies, I mean, it can seem like an impossible task. So what's your advice for us?
In my clinic, or in where I run my clinic, it's very difficult to repertorize each and every case, to be honest with you, because time is limited. There's a lot of patients. But what I'll advise to everyone who is listening me today, read 50 medicines, 50 polycress. Polycress are the medicines which have head to foot symptoms, which are the biggest medicines. But read those medicines like a mother knows her child. So you have to know the medicines from head to foot, from the emotionals, physicals. And if you know 50 of those medicines well, you can have a very good practice and you can go ahead. And the rest of the small remedies, rest of the medium-sized remedies, you can always refer to the repertory. You can always refer to your books. But if you know 50 polycress, like a mother knows her child, you'll be absolutely, good prescriber. And I always shared this with my students, shared this with people who are listening in, that 52 weeks in a year. So if you study one polycress a week and, you have 2 weeks off, you can still finish 50 polycress by the end of the year. And read it from different classical books, Kent, Nash, Tyler. And, you'll always get a good picture of the polycress. So if you are to make a New Year's resolution, it should be 50 polycress in this year. And, one polycress a week, I think that's not too much of an asking even if you have a busy practice or even if you have a job. I think you can fit that in easily.
I like how you've broken that down into a practical step. And sometimes, it can feel so overwhelming in the world of homeopathy, especially at the moment, because there's so many new prescribing methods, new remedies, everything else, and it can feel overwhelming. But I love what you're saying. One remedy a week. The polycress have worked for us the past 200 years. It's going to keep working for us, but knowing it really intimately. But even with the polycress, don't you think sometimes, well, you won't think it because you know them so well, it can sometimes feel like there's so many overlaps and it can seem really confusing. What sort of tips could you give to people to really help them being able to differentiate and get it very clear in their mind? And you said read from different types of Materia Medicas, but anything else that you can give us?
Again, that's a valid question. I think, if we study the characteristics of each of the remedies of the polycress, and if you have a picture of the characteristics, it will always help you to differentiate between the related remedies. So whenever you're reading Ken gives a good picture of the emotionals of all the particulars. Nash gives a good picture of the characteristics. So, whenever you're reading different books, it will help you to combine the idea and get the portrait of the remedy. And I think that's always helpful to differentiate between related remedies. So learn the characteristics first. That will be step one. Then you can go to step two, where you are learning about the different particular areas of the remedy. So that's always helpful. And that characteristics could be emotional, could be physical. So that's always helpful, even if you're a beginner, and you read the polycress, it always give a good picture.
Amazing. Now, talk to me a little bit about slum prescribing, because I know that you see so many patients in India, and there's so many areas that are so poor and so impoverished where they can't afford very expensive treatments. So you have this incredible opportunity there to obviously see a lot of people, but you have to prescribe pretty quickly. What does that look like? Like us here in the West, I mean, I usually see about 5 to 7 patients a day. And, I only do that 3 to 4 days a week. So the concept of seeing 60 people, or, in some cases you would say your ancestors 150 people a day, completely blows my mind. So for us over here that are aspiring to be able to help that many people in a day, what does that look like? Paint a picture for us.
Yeah. I'll share a little bit of the background of the slum prescribing. We started this project called the Bengal Medical Institute. My father started in the 1980s, and we do give milk to poor children in the slums, and we do offer free homeopathic prescribing. So I go to a particular slum. I have few other doctors who go to different other slums in the city, and we give free homeopathic medicines to those areas, because conventional medicine is very difficult to afford for them. About the slum prescribing, there are a few factors which I think is very important to share with the world. You have to understand here that most of the slum clinic patients we treat are absolutely uncontaminated pictures, because they haven't been on allopathic medicines. They're not on other conventional medications. So you get a very clear picture of the patient with clear modalities, with clear sensations. So in that way, that is a very good aspect where we can prescribe. Secondly, in those slum cases, one of the factors which is also important, that patients do come to us where they haven't been on other allopathic drugs. So that is also helpful, and they want to start with homeopathy. So that is one of the factors which is also quite interesting. So when we ask the patient, and, if you compare, when I obviously treat patients in the West, also in urban India, and, we ask about the food desires, we ask about the generals. And, with those patients in the slum clinic, somebody who is working as a manual laborer, you ask them, what do you like to eat? And, they will smile at me and say, it's only lentils and rice. I don't have the opportunity to have sweet, sour, salty.
Wow.
So, even getting generals is a difficult thing, with the food desires. You ask them about your dreams. I work day and night and I go to sleep. I don't have any dreams. I wake up in the morning. So, it's difficult to get even the general. So, even with particular symptoms, like, I have a headache, this is the nature of the headache, and we prescribe on the basis of that, and the patient gets better. So that is one of the things which sets these people apart from, urban prescribing or prescribing in the Western world. And as I mentioned, about in say 3.5 hours, I have to see around 50-55 patients, in that point of time.
Wow.
But I try to make it rapid, and I try to make it classical as well. So, when you understand, in those cases, there are lack of general symptoms, lack of emotional symptoms, because the patients don't have the opportunity to think about, how do I feel or what do I feel? If I don't work today, my children won't get food at night. So it's almost that kind of a situation there. So we get lots of skin cases, because in the slums with very close living, we get lots of skin cases. And again, prescribing on what we see, look at the skin, prescribe. I get a lot of respiratory cases as well. And again, therefrom I've developed the idea of the cough sounds, the children coughing, the adults coughing, patients with a lot of tuberculosis in the Indian subcontinent. So we get a lot of cough cases as well. And, fibromyalgia, body ache due to the excessive overexertion. So there comes the utility of the injury remedies as well. So primarily they are on the top, and I try to ask about the present complaint. So, if it's joint pain, how it started, location, sensation, modality, cause, onset, duration. So I ask about these 6 points. And if I get generals, I ask a quick generals. If I don't get that, I'll prescribe on what is the presenting symptom. And, I've done this since 2012 and it's still going strong. So, I think that's one of the things which you can incorporate, and it's still classical prescribing, You don't need to always give, like hours to the patient, but you can still give 10 minutes and get a good classical prescribing.
And do you find that it becomes almost intuitive after a while, because you would probably, seeing as most of them probably do the same types of work and eat the same types of food, like do you find that you could almost look at a person and almost see what remedy that they're going to need because you do so many cases? To a certain extent, yes, I will say, but I try not to be prejudiced. So sometimes it gets to a point where I feel like when I see this kind of a skin, it's dry and there's cracks, and graphitis will come in my mind. But I try to limit myself and think, what else can come up? So I try to do that opposite way so that I don't become prejudiced. But it does come to you with the intuitions as well. It does, yeah. I think that intuition part of a homeopath is actually like just years of very hard work, and seeing lots of clients culminates in intuition. It doesn't come out of nowhere. It's actually lots of work behind that aspect of it. And another question is, if you think of your urban clients, I mean, because you travel the world with what you do, I just on Facebook, I see you in every photo is in a different country in the world. So you see clients from all over the world. And then if you contrast that with the slum prescribing, do you find that, as you said, with the urban prescribing, there's a lot of medications, a lot of suppressions, a lot of pharmaceuticals. Do you find that with the kind of clearer symptom pictures of the slums where there's not a lot of suppression, that they do respond to homeopathy quicker, or is it about the same?
That's a very practical question. And there are two factors of it. I do run a slum clinic. B, I also do run clinic in the rural areas of Bengal, where I go there about once a month. Again, in those areas, which in the village area, there's also lack of conventional medications. So in both the slums as well as in the rural areas, people are not so much dependent on conventional medicine. I get a very clearer picture. And also one of the factors which I want to highlight that, why slum prescribing is quicker. Because, patients will give you very clear modalities, which is like an uncommon modality. And, which urban patient won't give me. When an asthmatic patient comes to me and the patient is telling me that, I'm better by bending backward, or I'm better by sitting up, I get that modality, and, I can prescribe a Hipersal in those cases where the patient is better by, bending back. But for the urban cases, I won't get that opportunity, because whenever they have an asthmatic attack, they take the inhaler and, they can't tell me how it makes me better. So yes, lack of clarity of symptoms in urban cases because of easy access to conventional medication. B, I will say, yes, it takes a much longer time for cases to be cured in urban cases as well, because they're under, if the thyroid is a little bit high, they put on antithyroid medication. Blood pressure is a little bit high, they put on antihypertensive. So it gets much more difficult for those drug-dependent cases to be cured as compared to a patient when I'm seeing in the slum and seeing in the rural area, because they have not been on medications, A. B, they're giving me clearer modalities, clearer sensations, and it's easier for me to prescribe and, quicker recovery as well. But again, with urban cases in the cities, it takes much longer time. And even with cases where there is emotional symptoms, quite a lot of suppression with medicines as well in the city population as well. So I think it's challenging for treatment in the cities, considering because of the so much suppression. But I find also it's challenging in the rural and in the slum population, because I get to see a lot of advanced pathologies as well in the slum clinics, in the rural pathology. Like a person who is unable to walk, is paralyzed, he's coming to me for treatment, in the hope that, homeopathy can do something. So, that's also a bigger challenge, because I get to see advanced pathologies where perhaps homeopathy can help.
That's so interesting. And it's so true what you've said, because I constantly have that. I only treat women and children, and I constantly have that frustration in my clinic where so many of my clients are on the contraceptive pill. So if I ask them about their menses or their period, which is such an incredible treasure box of information for us to know, what is your hormonal system doing, but they can't tell me because they're on the pill. So you don't know, is the symptoms they're experiencing due to the drug, or is that their own unique symptoms? So it does make prescribing so much easier. So I'm really glad that you've mentioned that, because
exactly,
there definitely is something that makes it very tricky. Anything else that you want to say to us about the slum prescribing or the urban prescribing, or anything that you think the homeopaths or the general public listeners will find really useful?
We run a program in Calcutta, which is a 2-week program for foreign participants to come and see the slum prescribing. And I always emphasize that, in the Western world, or people who are listening from all over the globe, sometimes, we do throttle the patient and, ask for emotional symptoms, ask for general symptoms when they are not prevalent in the case. Obviously, in most of the cases, you'll find those to be there, but in some cases, those are not prevalent. And, we do not give that degree of importance to what the patient is saying, what the present symptom is, what's the modality, what's the sensation. So with years of slum prescribing, I have learned it's sometimes very important to give prime importance to what the patient is saying in terms of his particular symptoms, in terms of his modality, sensation. And sometimes that can itself be the totality to prescribe in those cases. So, in cases where you're stuck, I'll request those of you listening in today, go back to those cases, study those again, see what the patient was emphasizing on his major presenting complaint. So, sometimes that can be a guideline to prescribe in those cases as well. So that's very, very important. A. B, sometimes what I've learned from rural prescribing and also from slum prescribing, homeopaths do get bogged down by the pathology, by the name of the disease. Oh, this is cancer. This is a paralysis. I won't be able to treat it. But, again, keep your mind absolutely free from the pathology. What is the patient presenting to me? What is the symptoms? And, you can do the case. I have a case I've shared on YouTube where the patient was completely paralyzed. He had been hit on her back by her husband, and the paralysis started after that. Been to different neurologists without help. I took the etiology of injury resulting in paralysis. I had prescribed a Bellis-Pedonus, and she started to walk in 6 months' time. So sometimes as homeopaths, as beginners, do not get bogged down, do not get fearful or apprehensive by the name of the disease. That's what I've learned to be from slum prescribing. Be fearless and keep your mind concentrated on the symptoms rather than the pathology. So I think I
love that my T-shirt actually says fearless. That was quite.
That's the theme of today, perhaps.
Yeah, definitely. And actually, you made me think of that saying, not being able to see the forest for the trees. Because sometimes we're so, we want to make it more complicated than it is, but actually just keeping it really simple and just what is actually in front of you. Don't get bogged down by it all. Exactly. I like that. Yeah. You just dropped a golden nugget there that I want to get back to. You said a 2-week program. So does that mean that any of us from anywhere in the world can come and join you for 2 weeks? And
you are definitely welcome as my guest to come next year. So that's an invite for you, definitely.
Well, I will take you up on that.
Yeah. We had to stop it after the pandemic, but for 2021 and 22, But my father has been running that since 1980s, and I have taken that over since last 10 years. And it's a 2-week program in Calcutta where we take the student. It's primarily for foreign international participants, but we do welcome Indian students as well, where we do take them around to the slum clinics. We take them to the rural clinics, and we do make them see patients from our Calcutta clinic as well. We promise about 160 live cases in 2 weeks, but obviously it's more than that. But that's the minimum amount we do keep, that 160 live cases in 2 weeks. And people from all over the globe have come and have enjoyed, seeing live Materia Medica in action. So
that sounds incredible. Where do we sign up?
I will send you details.
Okay, so we'll make sure we put it in the show notes. So for any of the homeopaths listening to this that want to find out more information.
Sure.
For future. Yeah, that sounds incredible. And so can you talk to us a little bit more maybe about the Materia Medica? You said comparative Materia Medica. What does that mean for our listeners, and what can you tell us about that?
Sure. When listeners or homeopaths, those who are studying, I'm sure all of you are conversant with Kent repertory and Kent's approach. But one of the things which homeopathic colleges around the world do not emphasize, that Kent was an even avid reader of Materia Medica. And because Kent had so much knowledge, so much information about Materia Medica, that he could develop his repertory. So he had read about 10 volumes of heading guiding symptoms, and therefore he had that in his head, and he developed his repertory. One of the factors in today's world, in today's teaching, is people are taught repertory in the first year or second year, and they're not taught Materia Medica from an early age. And my granddad used to say, repertory is like the dictionary, and Materia Medica is a language. So nobody learns the dictionary first. You learn the language first, and then you can refer to the dictionary. So what I emphasize, or what I try to bring forward to the world, is that, again, going back to that, it's learn your Materia Medica, know your polycrest, and then you can always refer to your repertory for further information, for further enlightening yourself. So I have developed that understanding of Materia Medica and polycrest. And sometimes when you are reading the repertory, or when you're looking up a rubric, you'll find 5 polycrests mentioned for one rubric. For burning, if you have a look, you'll find 10 polycrests mentioned. But again, if you understand your polycrest, if you understand the characteristics of polycrest, then you can understand the comparative Materia Medica in that aspect. Like for arsenic burning, it will be better by heat. For a sulfur burning, it will be better by cold. So, that is the understanding of comparative Materia Medica. And I have tried to incorporate that obviously as ancestral understanding, but N.M. Chaudhary's Materia Medica, if the listeners have heard of him, N.M. Chaudhary is a very good book, and he was one of the first Indian homeopaths to write a Materia Medica. And he mentioned about comparative Materia Medica. Each remedy he has mentioned, like, for burning, 5 other comparative medicines. So, that sometimes helps to understand the finer differences. So,
yeah. And for our listeners, that's Choudary.
Yeah.
Right? Yeah.
Yeah. So, that sometimes really helps to understand the comparative differences. And I do emphasize on that, especially, people who have homeopaths who have repertorized cases who are having success, but there are a percentage of cases where you won't have that degree of success because you are not reading the Materia Medica and you're not understanding the differences. So sometimes that's really useful.
So you recommend that one as a good book for homeopaths, or perhaps even listeners who want to really get the nuances of the differences between the remedies, the polycrests.
Exactly. Yeah. Even if you're treating acute cases, if you got a cold, for a beginner, you're thinking of giving aconite. And in the aconite chapter, you'll find 5 different remedies mentioned for the differences for cold. So you can understand when to give aconite, when to give dulcamara, or when to give a Bryannian. Because if you repertorize, for a coryza, if you go repertorize for a fever, you'll find all the polycrests are coming up. All the acute cold remedies will come up. So that's really helpful for understanding the difference.
That's really cool, because that's one of the things that can be most deflating when you're a new homeopath, is when you do repertorize and all these things come up and you're like, well, there's like 200 remedies here. Where do I start? Yes. And Yeah. So when you know those nuances and you can really, get down to that, it really does make a big difference. And then when you talk about behavioral materia medica, what do you mean?
That's an interesting thing. As I mentioned, my dad used to travel as well and used to teach all over the world. And when I was, in college, I used to travel with him as well. And when we were sitting at the airport, he used to ask me, "Who is this? Who is this?" So, like a really tall, lanky guy who's, not got a clean shirt on, who looks rugged. He was sulfur.
Yeah.
A person who was sitting next to me in the flight, he opened his socks, and his socks, he had smelly feet. And Dad is telling me silica or baryta. So understanding from the gesture, posture, somebody was sitting in the airport and he was very reserved. He's not talking and he's very stoic, and it could be an atrium. Obviously, those are thoughts, but, just developing that eye that when somebody walks into your office, walks into your clinic, sometimes it's important to have the observational eye on and how he's behaving, how he's gesticulating, how his posture is. So, that sometimes helps. So, that I started, I used to do that, and, that has come up with me on my clinic as well. So,
That's really fun to do. Actually just sitting in a cafe and just watching all the people and guessing, what remedies they might be. But like you said, also just honing that skill so that we're seeing more than just what's in front of us, that all our kind of senses are engaged. And I find that sometimes I'll have a client in the clinic and, I might get this aggressive type feeling from them. And I'm like, why are they here? They clearly do not want to be here. I almost get this feeling like they're almost challenging me. And then one of the lectures I was doing, they were saying if you get that feeling from the client, it could be, I think it was syphilinum actually. I think it was the Colin Griffith webinar. But, not just what are you seeing, but what are you feeling? What's the energy that you're feeling from that person?
Yeah.
And sometimes, because I only see mums and children, sometimes they come into the clinic and the kids will make such a mess. There will be things everywhere. And the mums are apologizing the whole time. And I'm like, please don't apologize. And sometimes the kids are so loud, we can't even talk to each other. And I'll say, don't apologize, because even what they're doing, sometimes don't even need to say anything. You can just observe the way that the child is doing it. Are they throwing things? Are they hitting the mum? Are they jumping from one thing to the next? What is their energy? Are they very quick in their emotions? Are they uncoordinated? Are they coordinated? Are they trying to climb on everything? So us homeopaths, we try to keep a little eye on everything. So sometimes, you might not, the mum might not be able to get a word in sideways, but that in itself is enough to tell us which remedy the child might need.
Exactly. Yeah. Sometimes that observational study is itself an important part of the prescription. And I also like to share another thing, there's a very interesting book for the readers, People of the Materia Medica World by Gladwin. He was one of the students of Kent. And he mentioned, and that I think that I have loved that, it's a good read on your holidays as well. The sulfur grandson and the sorinum grandfather, they're together in the room, and sulfur wants the windows open and sorinum wants the windows closed. So, families who have, same characteristics. And I think that's a good read to understand that behavioral materia medica.
That's very cool. Did you say the book was called People of the Materia Medica?
People of the Materia Medica World.
I've never heard of that. Okay, yes. I'm going to look that up.
Gladwin was perhaps a student of Kent, perhaps, yeah.
That's very cool, because we have just had somebody on the podcast, 24th of June. Oh, actually, her episode's coming out today. Sunita Venchard, she released a book called, I want to say it's Revive, but is it Revive? It's a short word like that. And it's about Queen Platina, like the evil Queen Platina. Yeah. And then this person goes on, and each of the characters have got, is based on the Materia Medica. And I actually think for our new students, it's such a good way to learn your Materia Medica as well. Actually,
it's a fun way, you can keep those thoughts in your head, you can go, that helps as you go forward. Yeah.
Mm-hmm. Now you have an awesome YouTube channel. So that is one place that people can get hold of you, Saptarshi. But where else can people get hold of your work and your courses? And if they want to engage with you or book with you or, donate to your charity or something like that, where do they get hold of you?
In my YouTube channel, you'll find all the all the teaching as well as the part of the Calcutta program. There are quite a lot of videos on that as well. I have my own website which was started last year, and you can find details about my courses. I do run a postgraduate program which is based on the therapeutics, and it's a 12-session program. I'm into the second year for that. And I plan to start a new program on polycrest next year, which I think is 50 polycrest, like what I mentioned. And I'll try to do that. I'm trying to do that next year. And obviously, the Calcutta clinical program is run by me and my father. So that's, you'll find all the information in our website as well about the Calcutta clinical program. It's www.saptarshibanerjea.com. So you can find the details on that as well about our Calcutta program. And that's welcome to everyone. Our charity is, as I mentioned, is donating milk. We have 4 slum clinics actually, which is run by different doctors. So you can donate to the charity as well. It's also on the website. So those are some of the works which I try to do.
And if I'm allowed to put in a personal special request, your videos, like the coughing video, that's my ultimate favorite. I love your crying sounds video where you're actually doing the different cries and, showing the difference between the whimpering and the hard cry. And it really helps you to understand the remedy so well. And your stuttering video is so good as well, because if you just think of, the medical profession, if your child has a stutter or a stammer, we'll just stick a label on and say you've got a stutter. But in homeopathy, there's so many different types of stutter. So understanding how one is different to the other and how you actually make all those sounds. And it's amazing how you do that. So my personal request to you, please, Saptarshi, if you can do any more videos like that about coughs or about things that people do, you do it really well. And if you decide that homeopathy is boring and you want to go into acting, I think that would be a good role for you as well. You do that very good. Is there any last message that you want to leave our listeners with?
When I started off in about 2006-07, that people around me used to say homeopathy is difficult. There are only a few successful homeopaths. You cannot be always successful in that. But for beginners, for students, for those who are contemplating joining homeopathy, I will say, homeopathy is fun and it is simple. So, always keep yourself simple. Don't make it complicated. That will always go a long way into you having a busy practice. And also, I learned this from my granddad, that if you love your Materia Medica, jewels will fall before you like the falls of Niagara. He used to say to me that, love your Materia Medica, be passionate about it. And what you'll see in my YouTube videos as well, I always share about how the person is, how the nature is. It's like Naxomica is my friend, or Pulsarilla is my wife. It's like that, so your drugs like remedies, it's your family. And when you're passionate about homeopathy, you'll definitely have a good practice. You'll definitely help people. And one of the major ways of making homeopathy more popular in the world is by treating people, is by helping people. So, we do go and emphasize in different webinars about, teachings, but more you learn and more you can prescribe and help people, it will gain more importance in the present drug-dependent 21st century. So I think that's one of the very important things which I wanted to share.
That is absolutely beautiful. And I think that quote, we need to get printed and have it put up in our clinics to just, keep us focused on what really matters. That's beautiful. Thank you so much for sharing your time so generously, Saptarshi. I know you're a very busy man, so I really appreciate today. And I know it's going to mean so much to so many people listening. Thank you so much.
Thank you.